to Pain in the Podcass, your place to find out everything you've ever wanted to know about pain. My name's Dr. Joseph Parsons, and I'm joined by the wonderful Don Wijasoria and Dr. Joshua Craw. And today we're talking about paracetamol and pain. Welcome in. Hello everyone and welcome to another episode of Pain in the Podcass. Today we're going to be talking about paracetamol. But first, let's learn a couple of facts about ourselves and something we've learned about ourselves this week. So can we start with you, Josh?
Yeah, what should we do first? Learning or fact?
Let's have a fact, please,
Let's have a fact, okay. And this is one that we can just test out straight away. We've had a lot of bird facts for this podcast.
Why are you looking at me, Josh?
And I have one about myself, which involves birds. I know a lot of my facts about myself I'm really good at, but I am really good at identifying birds.
Okay.
I tell you what, go on Google, and we can do it. Let's do it.
Okay, so I have to get a picture of a bird for you.
I mean, we could look outside, but I'm currently looking outside, and there are no birds
There's literally
to be
not
found.
There's been a lot of birds this morning as well.
It's torrential rain currently, and we're filming this in, July?
Where do birds go when it's such bad weather?
Don't know, like shelter?
Yeah,
Like
but
trees,
isn't that in the
buildings?
trees? I can't see any birds in those trees.
Yeah, true.
I tell you what, get a few.
I've got a couple. Sorry, I've got one picture,
Yep.
and if you don't get this one, then
Okay. Yep, that's a bird.
I fucking knew it. I so fucking knew it.
wow. Okay, wow. Do you actually know what type of bird that is?
It's an owl.
It is an owl.
It's not a tawny owl. It's not a barn owl.
Well done.
It's not a snowy owl. So then it's one of the other owls.
Nice.
Right, Don, any idea what owl that
Fuck
is?
no, it's just a scary owl that's not a barn owl or a tawny owl. Those are the only two owl kinds I know.
It's a European eagle owl, my favourite bird,
Oh.
which can grow, I think, up to like a metre tall. They can be absolutely huge. They are terrifying. They steal like baby sheep. They'll just
Wait,
like
did you
fly.
say tall?
Tall.
Like they're
stood up.
Oh, that's terrifying.
Yeah, it's fucking terrifying.
Are they? Never mind. I
Do you know
don't
what
need to know what the tallest birds are.
Do you know what my favourite birds are?
No.
Crows.
Why?
Well, first of all, a group of them's called murder. But also they hold grudges.
Oh, I've heard about
Oh,
this.
yes.
Yeah, so
yeah.
crows, if you mean to crows, they'll start pecking you.
Magpies as well.
Yeah, magpies. Oh, swooping magpies.
I
in
think
Australia.
magpies just hold grudges for no reason.
They are dickheads, aren't
Yeah,
they?
yeah.
Oh, do you know magpies don't actually like shiny things? They're just kleptomaniacs. We just notice when they steal our shiny things.
That's
They
hilarious.
literally just take anything.
Yeah.
So that was
Maybe we
good.
could test it out.
What? Just put out a set of objects and see which one gets stolen first.
Just Josh, let's just put Joe's stuff out.
Oh God, it's run off with his phone.
It's ran. It's not even flown away. It's just ran. Just hobbled.
Oh God, it's just pecking everything.
All right, Joe. What is your fact?
My fact is that I hate yogurt.
What?
And do you know why I hate yogurt?
Did you have an off one or something?
Kind of. I used to love yogurt as a child until the age of about 7, and I used to get these little Thomas the Tank Engine yogurts. Like they had his face like printed on the top. They were really nice, very
Sounds
cute.
terrifying.
It was great. And then, yeah, I ate one day. I don't know if it was off or something, but I had one and it just all of a sudden tasted disgusting for me. Had the same thing with bananas as well, around the same age. Used to love them, ate one day and was like, these are awful, I hate them. And then I've never eaten them since.
I don't
Tried
think-
multiple times, but can't.
I don't think I've ever had a bad banana. I think no matter how mushed up they are, I think they're still fine.
Flavour-wise.
Flavour-wise, texture-wise,
flavour
yeah,
For me,
it's-
just I can't do it.
But two,
Smell, blah.
how often did you say choo choo every time you unpeeled those Thomas the Tank Engine yogurts?
No, it said it itself. They put it in the packaging.
It's just a little slidey speaker.
They pumped it into the packaging. No, it's like, you know, if you scream into a frying pan
Yeah.
and then put a lid on
Yeah.
and then release it, it doesn't actually work. But
So, bonus fact about bananas. Did you know that banana-flavoured medicine is actually flavoured like banana, even though it tastes completely different to bananas?
That's to mean like
Because-
fluoride.
No.
At the
no, I
dentist.
know the reason for this.
So, the banana flavour of banana medicine, when they made the banana flavour, it was the flavour of bananas, but that sort of subsect, subspecies, subvariant of that banana went extinct. So Just think, if we had bananas that tasted like that, just how much more banana-y they would be. Not this Cavendish banana that we've got nowadays.
You know what's interesting? That Josh gave a very interesting fact there, but me and Don were nodding because we both knew this fact before. We were both like, yeah, heard this before. But if you didn't know that at home, yeah, it's bloody interesting, isn't it? So when you get your banana-flavoured sweets or your medicine, now you know. Don, fact about you, please.
I think my fact is that
Is it something about
I laugh
birds?
because in every episode, Don does something. When we ask him for his fact, he'll start his sentence and then tail off and go, and then he'll give it the second time, every time. He'll be like, my fact this week is, and then go again.
it's because it's one of the first things we say on when we start the podcast,
Yeah,
so it takes a bit of time to get into the groove of things. But my fact is that I actually do like yogurt, unlike you, Joe.
Is there going to be some sort of battle here? Or?
Yeah.
What we could do, we could get...
Battle of the
we could
probiotics.
get a really long straw and blow at either end and see who's got the better lung capacity. Put yogurt in the straw.
How is that going to test my affection for love?
No, because you're going to try and...
Your affection for what?
I think I said my affection for love.
You did.
I'm running on very little sleep.
No, so think of it, right?
Wait, so if we had a huge straw
filled with yogurt,
filled
or
with
like
yogurt,
half
but I
filled
like
with
yogurt, so I would just want the yogurt, whereas you don't like the yogurt, so you would blow it away
But
from
I thought
you.
you'd want to subject.
Why are we testing my lung capacity?
I'm going to blow. I'm going to fire yogurt into your mouth.
Joe's gonna blow, I'm gonna suck. Yes.
No, I'm more meant.
Don's gonna
you could
get
try
Joe's
and
yogurt.
make me-
Josh cannot hold it in. He's lost it.
I'm more meant that you were going to try and force me to eat yogurt. Was my.
Oh right, okay.
But I get what you're saying because you like yogurt. It would be pointless.
Yeah.
Because you would just.
I would just have the
drink
yogurt. Yeah.
Yeah. Okay. Sorry, that was very, very pointless.
I hope that was a great visual for you, listeners.
Oh, Jesus Christ.
Josh, what have you learned about yourself this week?
What I've learned about myself is the joys of using a fountain pen. It's just instead of using a ballpoint pen or any other rubbish, just a good fountain pen, I don't know.
What happened to the boy from Yorkshire?
I am still from Yorkshire.
But I've got a fountain
But
pen.
it's a very
Now I've got
fancy
a fountain
pen.
pen. It's not a fancy pen.
It is a fancy pen.
It's not.
It's a pretty fancy
It's a
pen.
pretty fancy pen.
It's not. It's not.
It feels heavy.
It's just because it's made out of metal.
Yeah, that's a fancy pen.
That is a fancy pen.
It's not. It's just a normal pen.
Do you guys, to give interesting facts?
We're just
on the
normal
podcast-
pens.
If I can't see through it, it's a fancy pen.
Well, that's a fair point. I agree with that. Do you know about, this is probably a fact that both of you have heard, but again, an interesting fact for people listening who may not have heard it. You know, the US, like NASA, spent millions of dollars developing a pen that would work in space. Do you know what the Russians used instead?
A pencil.
Pencil.
There you go. Okay, so they did know already.
Yeah.
But there you go, another fact that you may or may not have known.
I also feel like this is a misnomer.
Is it not true?
I don't think it's true.
Is it not?
No, I
Well,
think
did the
I think
Russians also use a very special pen?
No, it's used a biro.
Yeah, but that wouldn't work.
That wouldn't
It
work.
does. Trust me.
Oh,
Why?
okay.
It was on
You think to
QI.
space?
It was on QI, I believe. I think it was.
You know what?
I
In
could
the
be talking-
breakdown, we'll let you know.
Yeah.
If you subscribe to us on Patreon, you'll get to hear it. And otherwise, you'll just have to mull over
Yeah,
this.
wouldn't
Or
the
you could
pressure kind of
Google it.
make up for it?
I just don't think it makes a difference. I think I remember Stephen Fry very clearly saying that it was a load of bollocks.
Fair enough.
And
And if
that
Stephen
is-
Fry said it.
Yeah, exactly.
So, Joe, what's your learning this week?
I have learned that when someone says where they're from, I have a pathological need to say, but I was made in the Royal Navy. This is a reference that no international listeners will get, but there's a series of adverts to try and recruit people to the Royal Navy that say, I was born in Blythe, I was born in Doncaster, whatever, but I was made in the Royal Navy. And I think every time someone's told me where they're from for like the past year, I have said, just as a reflex, but I was made in the Royal Navy.
What if they said they were from the Royal Navy?
Oh, fuck.
I was born in the Royal Navy. It was really weird. It was a water birth.
Very good. Very good. Don, what have you learned about yourself this week?
I've learned that the optimum amount of time for me to sleep is 5 hours.
Okay.
Yeah.
Are you like Margaret Thatcher?
I hope not in many ways.
I've always thought you looked the same. I always thought somewhere between Eminem and Margaret Thatcher.
I don't have the blonde hair anymore. Oh, that's another fact. There you go. I just have little wisps of it. But yeah, 5 hours just seems to do the trick. I feel fairly rested, but also, more importantly, I feel very energetic. I don't know why.
That's your body screaming.
Oh yeah,
It's just constant second wind.
I don't think I've tested it for more than 2 weeks, so like 2 weeks of consecutive 5-hour nights. But because I think at that point it does get exhausting. But
So your optimum is to have 2 weeks of 5 hours a night and then a massive sleep debt.
Yes.
Okay.
Yeah.
Apparently, I was reading a book a while ago called Why We Sleep by Matthew Walker, and he says that even if you have a really late night one night, you should still wake up at the same time every day. He says, like, keeping your body clock is more important than the quantity of sleep you get. So if you sleep, let's say, 10 p.m. to 6 a.m. every day, even if you go to bed at 3 a.m. one night, you should still try and get up at 6 a.m. and just basically raw dog it for a day.
Oh, as a doctor who works in A&E, I am absolutely fucked.
I was going to say, who does night shifts and...
Evening shifts.
I was going to say, if Josh wants to wake up at 7 a.m. every day, he'll have to wake up before some of his shifts have even finished. You'd hope he wasn't asleep during the shift.
Okay, so with that, we're going to go into today's topic, which is the thing that the NHS spends £80 million on per year, and that is paracetamol prescriptions.
Jesus.
£80 million per year. And so it costs an average of 3 to 4 times more to prescribe paracetamol via the NHS than for the patient to just buy it themselves.
Yeah. At the minute, I think last time I was in Home Bargains the other day, I think it was 47p for 24 paracetamol. And so the NHS is paying like £1.50-ish to prescribe that to you, because you've got to think the cost of the doctor's time to prescribe it, the cost of the pharmacist's time to dispense it, like the cost of them buying it through approved sellers. So it just ends up being insanely expensive.
Also, I'm assuming if you were to get it prescribed, you have to go to the pharmacy or wherever and then stay in the queue just to get paracetamol. I just think that's hilarious.
Yeah,
those queues are so long, and then you're going to stay there for like 40 minutes just to get paracetamol.
When it would be... I know it's... Obviously, I understand the finances is an important element for some people, but it would be so much better if the NHS had like a paracetamol bursary, where they just had some petty cash in every GP practice and were like, here's 47p.
Yeah.
See, I'm going to tell you what... actually, that would be a really good idea. But I'm going to tell you why I think actually charging more for the NHS is a good idea for paracetamol. It's going to be a hot take, guys. Right?
Great tell.
So when we make deals with big pharmaceutical companies, we agree on certain prices for certain medications. Okay? So actually, the high costs, say, cancer medications and those biologics that cost thousands and thousands, we get those at what would be considered a reasonable price, but the cost of that is we pay extra for paracetamol. I'd be interested to know if the maths on it.
See, this is a hill that I will die on, and one that desperately upsets me with the NHS, considering how much I love it as an organisation. I think it genuinely is the most impressive organisation on earth in terms of providing free healthcare at the point of need to such a vast number of people, and yet we signed drug deals with Big Pharma where we're paying for drugs to the original company that patented a drug, even when it's off license. So
What?
I used to work in breast cancer, and there's a drug called trastuzumab, or you might have heard it called Herceptin. If you've got anyone in your family who has had breast cancer, you might have heard them talk about it. And we still buy it through the NHS, or at least at the time of my PhD, they still bought it from Roche for the original cost, which I think off the top of my head was £26,000 a year. There are biosimilar companies, so now that it's off patent, so it's no longer covered by their patent, they can produce it for £700 or £800 per year, and we're paying £26,000 because we made a deal with Roche, even though it's been off patent for like a decade now.
Do you know why it costs £26,000 a year?
Because it's lining the pockets of Big Pharma?
No, because that's the figure that they use for how much they're willing to spend to add an extra year to somebody's life.
Yeah, quality adjusted life years.
Yeah, quality adjusted life years. So we've talked
Hold
about...
on, I think that just broke my brain. Wait, so you're saying that extra cost is them justifying the intent of it?
Yes,
So
effectively.
the NHS has something called quality adjusted life years, which is where we can justify expensive, I say expensive, it's all relative for saving somebody's life, relatively expensive medications or interventions. And they typically use dialysis as sort of a benchmark. So is it cheaper or less cheap than dialysis? Dialysis costs roughly, this is off the top of my head, this is an exact figure, it's somewhere between £25,000 and £30,000 a year to dialyse one patient for a year. So they say, okay, that's roughly the figure.
Yeah.
So big pharma companies, okay, we've got a new medication. What's the most we can sell it for in the UK? I know. Let's see if we can get it at the most, which is just less than 30,000.
So a quality adjusted life year is basically worked out. They do, during clinical trials, they do questionnaires about quality of life, and then they look at how effective it was in improving quality of life, and then they attribute the cost that it cost them to make it to the amount of quality of life improvement, and that's how you work out how many years of quality life could it add to your life for how much money. So say that I could give you a pill that costs £10 a year, and it will give you 1 extra year of life that's high quality, where you're not unwell. Or
How much is that year worth?
That year is then worth £10. So that quality added life year is worth £10. The NHS is willing to pay, like Josh says, up to £30,000 for a year of quality adjusted life.
I don't understand that though, because shouldn't that be based on what the patient values it as and not what the NHS values it
But
as?
it is based on patients from trials. So it's based on how patients' quality of life improved in trials as an average.
But it's the NHS who's negotiating the price, not the patient.
Yes, but they negotiate it based on clinical trial
So the
data.
patient would have. So in those trials, the patient would have given, or whoever's taken who's ever participating would have given a rough estimate.
Precisely.
Okay.
Yeah, so they're using the patients in those trials as a ballpark for
Right.
how much the drug can improve quality.
Sorry, I thought it was just the patient answering, yes, this has indeed improved my quality of life. Or
Now I'll
not.
have £30,000, please. No, yeah. So sorry for those listening. It's quite a complicated concept.
What's it called again?
QALYs, quality adjusted life years. We'll see if we can find a video and put it onto our social media just to give a little bit more explanation. One thing that is particularly interesting, though, going on from this £80 million a year, between that amount of paracetamol that's prescribed and the sort of general paracetamol bought in shops, would you like to have a pot shot at how many tons of paracetamol are sold in the UK every year?
790,000. No,
Kilograms or tons?
I'm gonna go 790 tons.
Well, I would say there's about 60 million people in the country. One dose of paracetamol is roughly a gram. So 60 million grams is what I would say. What's that in tons?
60 million grams.
I don't know.
600 tons, maybe? I can't work out. 600 or 6,000. Either way, if it's 6,000, you're
6,000
pretty
tons.
much on the money. 6,300 tons per year, which is equivalent to 70 tablets per person per year for every man, woman and child in the country.
It's a good thing this isn't going on the official scoring list.
It really is, isn't it? But there will be a game later on in the episode that does go on the scoring list.
Yeah, so that's what? 1.5 paracetamol per person per week for the entire population?
That's a lot.
It is a lot.
For every child, I mean, if we're taking children into account as well, that's
Exactly.
crazy.
When you take into account people hitting our age, like late 20s, early 30s, when everything starts to hurt for the rest of your life, it kind of feels a little bit more reasonable.
I'm up to
but-
I'm up to paracetamol with every meal now.
Are you?
Yeah.
Just as a
crush
little
it in,
aperitif.
yeah. Yes.
I was about to say, though, I mean, if you're taking 8 paracetamol a day,
Yeah. But really, in an ideal world, and we'll come to this towards the end of the episode, like side effects of paracetamol, you don't really want to be very, very long-term on high doses of paracetamol. As with any drug, really. Like, your body is built to function as its own machine, and ideally it doesn't want external influence.
my machine needs a mechanic.
How young is it? How young do they start prescribing paracetamol? At like what age?
Birth.
At birth?
Yeah, but is it
At
12
conception?
is oral paracetamol tablets? Is 12 years old?
No, I give paracetamol to infants.
You can get like children's paracetamol.
It's all
Is it lower dose?
it's low dose. So what you do
Okay.
is pretty much from 12 you can give adult doses, and
Alright, that's
before
what
that
it
you
is,
give weight adjusted doses.
Oh.
So,
So if you've got a really, really fat child,
yeah,
then
genuinely
they can have an adult dose.
So any parents here listening, you might notice that on the back of a bottle of Calpol it'll tell you what dose to give your child. However, if you've got a little chunker, there's actually there's a weight-adjusted dose. Now, I'm not recommending that you give your children any more than what is recommended on the product. Don't do that. But if you was to come into hospital, we may send you home with a very informative leaflet which tells you how much you can give your child. So, just to clarify, don't be giving your children more paracetamol than it says on the pack, but
Unless they're chunkers.
No.
And at least, unless they are medically informed chunkers.
Yeah, so don't do that. But if he was in hospital, we would adjust the dose. So yeah.
Interesting. Thinking about paracetamol usage in hospital, there was a study of nearly 1,000 British A&E patients, and they had a list of 15 different pain medications. And on average, so some of them had paracetamol in and some of them didn't, and they only managed to get 6.25 out of 15 on those marks, so they were wrong more than 50% of the time. But I want to ask you, what percentage of people do you think thought that ibuprofen contained paracetamol? And for those of you at home, ibuprofen doesn't contain paracetamol. It's a completely separate drug. It's a non-steroidal anti-inflammatory. It has nothing to do with paracetamol in terms of its chemical structure, doesn't really act on the same sites.
A quarter?
I'm going to say 45%.
Wow, Dom, that is a fantastic guess. That is 46%. He's only 1% off. So yeah, the understanding of what paracetamol is and what contains paracetamol is really not very good. So that's why you're here listening today.
Indeed.
Because there's a lot of things that we don't know about it.
But one thing we do know about is how it was discovered.
Yeah, so to go back into history about paracetamol discovery, we first have to talk about something called acetanilide, which was discovered back in 1852 by a French chemist called Charles Gerhardt. And in 1886, French doctors, I think it was Arnold Kahn and also Paul Hebb, they went to the chemist. They said, "Do you know what we need? We need some naphthalene, to treat some intestinal parasites. We've got some patients and we need to treat them."
And they've got worms, basically.
Yeah. So naphthalene, for anybody that's not in the know, it's one of the breakdown products of oil when you distill it almost with heat. Not a very good thing, and I wouldn't recommend anybody eating naphthalene. Anyway, the pharmacists, human error, accidentally gave them acetanilide, which the doctors felt had reduced the fevers in some of the patients. So they was like, wow, okay, well, this is quite interesting.
Yeah, because the pharmacists then came and owned up to their error, so they realised what had happened, that they'd given them the wrong thing. But it seemed to have worked, right?
Yeah, absolutely. And if it hadn't been for that error, who knows, we might not have had paracetamol.
But the reason why they didn't keep on using acetanilide was that people kept turning blue.
Oh.
Why were they turning blue?
Because they had methemoglobinemia, which is where your hemoglobin, the chemical in your blood that carries the oxygen around your body, has a modification that means that it becomes less good at carrying oxygen around your body. So when you don't have oxygen, people speak about turning blue when you have, let's say, a respiratory disease, for example, when you've got issues with your chest. Sometimes people will have, blue lips, blue fingertips.
Cyanotic.
Cyanosis, exactly.
Good pronunciation.
Thank you very much. But paracetamol was specifically first synthesized for human use a year later in 1887 by Joseph von Mehring. But he decided that he was comparing this to another drug called phenacetin, and he decided that phenacetin was better, and so decided that he would ignore paracetamol entirely. But then, nearly 60 years later, David Lester and Leon Greenberg were studying acetanilide, and they found that one of its major breakdown products in your body, as your body sort of digests it, was paracetamol. And so they then started looking into its effects again and decided that they wanted to kind of pick this back up, start using it again.
Yeah, so sort of like taking out a whole step. Well, if we've got paracetamol, why do we need to give them this other product, right?
Exactly, especially because going back to that earlier statement, the acetanilide kept turning people blue.
Oh, so did paracetamol turn people blue?
It did not.
Fantastic.
It is strange to think that such a widely used drug was only really kind of came back into the picture about how long ago was that?
80 years ago?
80 years ago?
You're completely right.
Actually, 80 years is quite a long time, isn't it?
But
It's World War II.
equally,
Yeah.
you say this, but for a drug to be the most prescribed drug on Earth, you would kind of assume that it's just been around almost time immemorial.
Yeah.
Opium.
Exactly.
Yeah.
Exactly. But what's really interesting, though, is we don't actually understand very well about how it works.
Yeah, so the way paracetamol works, and I'm glad you said you didn't really know how it works, because the truth is we can't say 100% how it properly works. But all the research, well, the main research points towards something called COX. Pause for dramatic effect. Yes, COX.
COX.
COX. So that's cyclooxygenase, which is an enzyme, which, as you might know before, is something that either makes or breaks down other things in the body. So cyclooxygenases, or COX, they tend to make prostaglandins. And prostaglandins are pro-inflammatory proteins, which cause all those nasty things like pain and what have you.
And so, basically, in 1972, this researcher found out that paracetamol was able to block these little machines inside your cells, and so it prevented that production of these inflammatory chemicals, which can then reduce pain. And it particularly found that it was 8 times more effective at blocking these little machines in your cells inside your brain and your spinal cord than it was in blocking it in the rest of your body. And so it's suspected that there's this kind of central mechanism. You might have heard people speak about the central nervous system before. That's your brain and your spinal cord. And so it's more effective at blocking those receptors in there. So it might be this mechanism where it's preventing your brain from processing the pain in the same way.
So the main effects that we know about paracetamol are for pain relief. We mentioned prostaglandins, but also for the antipyrexial effects. So that's fever-busting effects. And it's because they work on those same mechanisms, those enzymes, those machines that we've mentioned, those COX proteins, and it helps to prevent fever. Yet again, we don't fully know the ins and outs, and trust me, this podcast would be incredibly tedious if we went through it in great detail, but there's lots of different COX knocking about.
I know there's at least 3.
There are at least 3 COX. And that's not a weird reference to us as the 3 hosts. There genuinely are 3 COX enzymes that it blocks. 3 COX blocks.
COX blockers!
There is one other way that it's thought to work. Actually, 2 other ways that it's thought to work as well. One of them is it's thought to switch on pathways in your spinal cord which tone down the pain response via the serotonin pathway. So you might have heard of serotonin being like a happy chemical. And so it's thought to trigger this pathway that then helps to tone down your pain response. But very interestingly, one of the breakdown products, so when your body processes this paracetamol, actually prevents your natural cannabinoids. So you might notice cannabinoid sounds like cannabis, and that's because it's part of the same chemical family. Your body naturally produces chemicals very similar to those found in cannabis, and they act in the gaps in between nerve cells in your brain. And so paracetamol breakdown products can actually prevent these from being taken up into the nerves, so they sit in that bit in between the nerves, and that's where they have their activity. So basically, it does the equivalent of activating your cannabis receptors.
Ah.
Cool, nice. Man. That's cool.
Exactly. But I think, Josh, you had a couple of comments to make about what happens when people take too much paracetamol.
Yeah, as an emergency medicine doctor, I unfortunately see a lot of people that have taken too much, either accidentally or on purpose. And it's interesting because the toxic dose for paracetamol is as little as 7.5 grams. That's 15 tablets? So that's a pack of paracetamol can be toxic if you take it all at once.
Yeah.
That's not to say that it's going to cause significant damage, but it potentially can. And the way that we treat that is we try to stop it from working. So if somebody was to come within an hour of accidentally taking too much paracetamol, we would give them charcoal. So that is literally activated charcoal. That's ground down charcoal in a liquid that you drink, and it stops your stomach from absorbing any more of the medication.
Does it make like a lining almost, like a coating on your stomach?
Well, the thing is, activated charcoal is just very good at just blocking all that absorption. So you tend to find, like, do you remember a while ago it was all it was all the rage to have like charcoal smoothies.
I was just about to ask this, yeah, because the whole thing was, it really clears your body out, it removes all the toxins, but it sounds like it's just blocking everything.
Well, there were cases with that. I will have a look for the breakdown for actual references, but there were cases where people were taking these charcoal smoothies and it was decreasing the effectiveness of their regular medications.
Yeah. Oh, wow.
Because it was blocking the uptake.
I know there was one brand of water that just made charcoal water.
That just isn't something that I want in my water. If you gave me some water that had like basically dust in it,
Yeah, but you have
That's
to think
like
it's,
London
it was
water.
it was around the time where people were putting charcoal in everything, like toothpaste.
charcoal toothpaste supposedly is good. I don't know the science
Yeah.
behind this, but I do have a lot of people who've preached it to
I
me.
think it's just because it's a mild abrasive. Do you know like Arm & Hammer that uses sodium bicarb? It's a mild abrasive.
So if I used very fine grit sandpaper, it would have the same effect.
Yeah, it would. I would not recommend this. I'm not a dentist and I cannot give dental advice.
You know, there's like electric toothbrushes. You should just attach some sandpaper
Sandpaper on
to
the
a
end.
drill and just go at it.
Yeah, so how is paracetamol toxic to us? Well, paracetamol gets broken down into the liver into multiple different metabolites, so breakdown products. And your liver has a chemical in it, I think it's glutathione? Yeah, glutathione, which helps to mitigate one of the breakdown products called NAPQI. Now, we don't need to go into great detail about that, but once you've run out of that counteracting chemical, glutathione, you get a toxic buildup of that NAPQI, and that causes damage to the liver. So, trust me when I say, paracetamol overdose is not the way you want to go. It's not quick, it's incredibly painful, distressing, and horrific. It would take a minimum of, could be a couple of weeks of being in agony, and it's not something that anybody should go through. The way that we cure this is, we give something called NAC, which is N-acetylcysteine, which is effectively artificially giving you that product that counteracts the toxic breakdown products.
So it's like an antidote.
It's an antidote, yeah, absolutely. Rather unfortunate though, approximately I think it's 1 in 6 people can have an allergic reaction to it. It might be slightly higher than that. We'll let you know in the breakdown. But yeah, so there is a cure to it, but it's not ideal.
It's not perfect.
So I have actually seen people who come in with what we call a therapeutic overdose, which is accidentally taking too much medication.
Yeah.
I remember
because they've taken like Lemsip, and they've also had their 8 paracetamol a day.
Exactly.
And then they've also had Calpol, and they don't realise that, well, 46% of people think that ibuprofen has paracetamol in, so, and only, they got less than half.
Wait, hold on. You're telling me Lemsip has things other than Lemsip?
It's just
What?
100%
It's
Lemsip.
just, what?
Okay, this leads me to a really tangential point. I had a conversation with a friend 5 years ago, and we were talking about what milk contains, and I was like, yeah, so milk contains fat, and it contains proteins and some sugars, and they were like, and I was like, that makes up about like 20, 50%, whatever I said at the time. I'd been reading about it, and they were like, yeah, and the other 50% is milk, and I was like, what? I was like, no, the rest is water. And
a
they're like,
little bit of
But
calcium.
where's the milk? And I'm like, no, everything is the milk. You can't. And then this led me to looking up the fat percentages in different types of milk. And then I found out that whale milk has nearly 50% fat, which means that it comes out like toothpaste. And I really want to try whale cheese. I found a website that sells it in Canada, but they won't ship internationally. So if anyone wants to post, well, actually, please don't post me any whale cheese. I don't trust what you've put in there. But I want to go to Canada one day. It's on the bucket list, and try whale cheese.
I don't even know where to start with that one.
I did not expect that when I woke up this
What
morning.
the fuck are you reading about milk?
I don't know. I really don't know. I was reading about milk. Oh, I think it was because I was reading about breast milk versus formula, because someone was saying about like developmental like progress with breast milk
Okay.
versus formula, and so I was reading about different types of milk, and then I was learning about the contents of milk, and then someone told me that milk was 50% protein, fat, and sugar, and 50% milk. Which then how is it's like you know the Hindu thing about the world being stacked on elephants that are all on top of a turtle. This is getting really tangential.
The world is stacked on elephants, stacked on
a turtle. Yeah, this is like.
Do you mean like one of those massive turtles, like in Avatar: The Last Airbender?
Yes.
Okay.
But like the Earth is stacked on top of turtles.
What?
It's just go and read about it, honestly.
But what's below the turtles?
Well, exactly.
It's just turtles all the way down.
But this is, according to my friend, what's the milk? If 50% of milk is milk, then does that mean that that milk then contains proteins, fats, and sugars, and 50% milk? How far does the percent milk go?
Okay, where was we? Yeah, so I do recall a specific case, which was a pregnant woman who'd done exactly what you said, Joe. She'd pretty much been taking, well, not Lemsip, but she'd had some cocodamol, and then she'd had paracetamol on top of that. She'd had horrific dental pain, so that's why she was taking regular paracetamol. And then she had a bit of cocodamol afterwards and didn't realise that there was paracetamol in it, and she came in having what we call a therapeutic overdose. She was absolutely fine. Baby was fine. In fact, I then treated her child later on in the year whilst I was doing pediatrics, and she said,
That's cute.
I remember you. You was really good. And I was like, oh, God, no, I wasn't. But, yeah. So, recommendations. If you're an adult, don't take any more than 8 paracetamol tablets. That's 4 grams of paracetamol in 24 hours. And if you've got any health issues, including any issues with your liver, please discuss this with your pharmacist or your doctor in advance.
So moving on to think about pain specifically, something that may shock people is that if you look at the NICE guidelines for chronic pain management, you will see that paracetamol is expressly not recommended. So it is in the do not prescribe paracetamol for people with chronic pain as a line of chronic pain management. So that's not saying they can't have it for other things, for like acute temporary things, but it is expressly recommended that you do not give it for chronic conditions.
So we've talked about this in the previous episode, but when a doctor says, oh, have you tried paracetamol? You can then just turn to them and say, well, doctor, this is chronic pain. Have you not read the NICE guidelines? It specifically says not to give paracetamol. How up to date are you?
And then your doctor will tell you where to stick it. But I mean, in terms of sort of chronic conditions, you look at a condition like osteoarthritis, for example, it does outperform placebo in long-term usage. However, it only induces a 4% improvement in your pain, on average.
Do you know what, though? 4%.
But the thing is, when you've got to weigh up all the side effects, we'll talk about the side effects later on, but 4% isn't really worth it. It doesn't warrant how much the side effects will do to you.
So we know from previous episodes that the Australians just give out loads of great research when it comes to pain, don't we? Mm-hmm. There was one that looked at the emergency department in Australia, and it showed that 4 hours after taking paracetamol, that there was roughly 20% or greater decrease in the levels of pain that was perceived by people. So from that point of view, for acute pain, it does seem that paracetamol does work. And as we've mentioned ad infinitum, we've got the WHO Pain Ladder, World Health Organization, which does recommend paracetamol as that first rung as a fundamental basis for controlling pain.
Yeah. That same study, though, was comparing oral paracetamol, so tablet form, versus intravenous, so where they inject it into your veins or where they use like a cannula to put it into your veins. But they found that in both of these groups, nearly 85% of people required what they call rescue opioids, which means basically that the paracetamol isn't hacking it as a pain management. It's not doing sufficient to get their pain under control, and so they're being given opioids on top, so things like codeine or morphine to get that pain under control. So it does have some effect in reducing the pain, but clearly it's not doing sufficient to manage these severe acute pains.
Do you know what my thoughts of this are, though, as well? Like, as an emergency medicine doctor, I have to give that first line of pain relief. I do wonder that if these effects between IV and oral, are they actually there? Or is it a case of, if I tell you I'm giving you some IV pain relief, you're going to think that it's working stronger? So, yes, you're going to get a better effect.
There was a study that I need to dig out of my notes because I haven't read it for years that said that if you give people a tablet versus a bigger tablet, and it's the exact same thing, if you give people placebo pills and you give them a bigger tablet, they're going to assume it'll work better. If you then give it as an injection, they're going to assume that it'll work better than the tablet. Exactly. Even though it's all placebo, people's perception of how you give it. So you're right, it could just be that intravenous is better in that respect.
Yeah.
Or I did have a conversation with a good pharmacist friend of mine about this because I needed to understand it better. If you take a tablet orally, it obviously has to get through your stomach, it's getting processed by all your digestive system, and so how much of the drug you actually absorb into your bloodstream where it's doing its job is a lot less than if you just inject it into the bloodstream.
But the thing is as well is we alter the doses depending on whether it's IV or oral, not necessarily for paracetamol, but antibiotics. So if I'm giving IV comoxiclav, I'm giving you 1.2 grams in a dose. If I give you oral comoxiclav, I'm giving you 625 milligrams.
So less
Half
than the
a
oral
dose.
dose.
Yeah. We also find it with some other medications. I think it might be metronidazole, which is 400 milligrams oral versus 500 IV. I could be mistaken there. But yeah, some medications are just so well absorbed that we just say, bugger it, there's no point in us giving IV.
Interesting.
Does depend on the clinical picture, though. One thing I find interesting as well is talking about those sort of bigger pills and the effects psychologically is the colour of pills. So if you give somebody a red pill, it's better at pain relief.
Really?
Apparently so.
I would have thought just white would be better.
I know the red one's like, yes, that this is going to work.
And if you give them a blue pill, they go into the matrix.
If you give them the blue pill, they have to go into the bathroom and cover themselves over.
Viagra.
Okay, thanks for clarifying that, Don, because I was completely none the wiser as to what Josh meant
You
by
look
that.
so confused.
You're a lucky man, Joe.
I was trying to work out if you were making a Matrix reference.
No.
And you were just referencing Viagra, okay.
Yes, again, it's a Cox joke.
This episode is full of cocks. Thinking about specific pain conditions, so a couple of those were just talking about general acute pain or general chronic pain. Looking at back pain specifically, there was one study in A&E that looked at people who had turned up with back pain, and they found that in the very, very short-term window, so over the course of an hour, paracetamol could reduce back pain by up to 50%.
Yeah, so the majority of back pain that we see in like A&E, for example, is acute. So that's either a sudden worsening of chronic back pain, or it could be traumatic. So somebody's been in a car crash and now they've got back pain. Somebody's fallen down the stairs, now they've got back pain.
They've lifted something and all of a sudden they feel like their back's given way and they're bent double and they can't straighten up.
And occasionally we do get people that just come in, they've had a back pain for a couple of weeks, but they can't get a GP appointment, so then they come into A&E, which is somewhat inappropriate, which is why I was saying don't get me started. You do need to see a doctor if you've had ongoing back pain. A&E might not be the best place.
Yeah.
Yeah, because the reason I asked that was because I still have the kind of, in my mind, it's just seared into my mind that A&E is only for like when your arm's been torn off, and not for like chronic conditions.
Yeah.
And so that's why I just asked.
For you, A&E is just like blood all over the waiting room.
Yep.
And people screaming.
Yeah.
There is still all that. Like you go into A&E on a Saturday night, it's wow. Okay, here's the stories. I've once had in my A&E where I work currently, we've got a desk in the middle of majors, which is where the doctors sit and write the notes. I have had a gentleman behind me crouched on the floor pooing before.
What?
Yeah, it's just in the middle of majors.
But I thought
How did he get in there?
Sit.
Yeah.
It wasn't a doctor, was it?
It wasn't a doctor. Yeah.
Did the patient just sneak in?
He was a frequent. We call people that come in very regular. We call them frequent flyers. Yeah, he's just one of our regulars.
Frequent shitters, yeah.
You know, he didn't frequently shit. I mean, he did, but like not on the floor. Yeah, I mean, what do you do? You can't drop. You can't like. What are you going to do? You just call security and just get it cleaned up, don't you?
I guess so.
So yeah, it's interesting.
It's really keen on.
You know what? There are many ways I've thought, like in my long chronic pain journey, and I felt like I maybe wasn't getting the care that I needed and or deserved at various situations. But to get attention from a clinician, I have never thought to just take a dump on the floor.
I'll be honest with you, he got absolutely no attention from any of the clinicians.
They were like,
yeah, I don't think that's very effective.
No, this is what
maybe
I mean.
pissing on them would, because I feel like that's active, whereas pooing is
that is assault.
Exactly, whereas pooing is just not enough.
Hey, when you gotta go, you gotta go.
Okay,
Better out.
Can we
I
please
guess.
move on from this,
Yeah,
because I'm not
please
enjoying
move
this.
on. Something that, again, like Josh said earlier on about correcting your doctors when they try to give you paracetamol, there is a study of back pain patients in A&E and like with acute back pain, and they found that paracetamol has no benefit over placebo in terms of its ability to reduce pain, in terms of its ability to improve your quality of life, to improve your function, to improve your sleep, to reduce any disability, so any change in your physical capabilities.
It's because we're all stupid and placebos are great.
To be fair, placebos are great.
I'm a big fan of just giving IV morphine. You think I'm joking? I'm not. If you come in with severe pain, it's completely irresponsible for clinicians to go, well, to have some paracetamol, we'll give it a couple of hours. I know you're arriving in pain, you got 9 out of 10 pain, but it's not. Like the Royal College of Emergency Medicine says that for severe pain, so like pain that's 8 out of 10 or more and acute, we should be giving IV morphine, not Oromorph, not codeine. We should be giving IV, bam, get your pain under control, and then we can start off with those lesser medications to try and maintain that level of pain relief.
Isn't that what they do in the movies?
That is kind of what they do in the movie, isn't it?
I mean, it's what we should be doing.
IV morphine stat.
And do you know what? There's
Do
so many,
it like we do.
so many clinicians that just don't follow those guidelines because, like, if you're in pain for another 4 hours, like if you're an elderly person, for example, you're at high risk of becoming delirious, becoming more confused because of the pain. it's just bad for everybody.
Yeah.
Sorry, on a rant there.
No. I think, Don, you had a look at, because that's back pain, and we're saying it doesn't seem, according to the research, it's particularly effective, but I think you'd had a look at migraine and headache.
Yeah, so I found out that for when addressing migraines, or migraines, however you want to say it, patients felt the paracetamol offered nearly 2 times more pain relief than the placebo. And then in tension-type headaches, paracetamol had a 1.3-fold high rate of pain relief after 2 hours than the placebo, and 42% lower requirement for rescue medication. Is that kind of what you were suggesting earlier about the rescue opioids?
Exactly, and so it wouldn't necessarily be opioids for migraine, it might be other sort of headache drugs. But yeah, so paracetamol does seem to have these kind of benefits in those. I think we've all had tension type headaches, those kind of like usually at the front of your head, throbbing, you often feel them behind your eyes, kind of get it almost like a headband feeling. And so it is quite effective in the short term at treating those. Anyone who's had migraines might have tried paracetamol before and found that it's quite effective. So I think one thing that we need to be careful of in this episode, and that we hope you can understand at home, is we're not saying paracetamol is a bad drug. We're not saying it's ineffective all the time. We're saying that we just need to be a little bit more sensible with how we use it. Obviously, if it's costing the NHS £80 million a year, if we're using 6,300 tonnes a year just in the UK, I think that's the point where you need to kind of reflect on your usage and whether it's doing the job correctly.
Yeah, and like in terms of cost, just IV versus oral as well. Like IV paracetamol's 50 times more expensive than oral paracetamol.
Jesus.
Oh my gosh.
Yeah, I think I've got a nice table. 1 second. Yeah, so looking at one visual from, let me see, where are we? I think it's from Leeds Formulary, so from one of the Leeds hospitals. Normal tablets cost, this is for 1 gram, so that's typically 2 tablets if you used to buy it at home. Typically cost 4 pence, so 2 pence a tablet. If you was to give it in a soluble tablet, so that's ones that just like you put in water that dissolve, that's 25 pence a dose. That's more than 5 times as much. If you used to give it in liquid form, so if you got a patient that can't swallow, that's like 60 pence. So yeah, again, we're creeping up there, aren't we? Intravenous, £2.30.
Jeez.
So that's 50 times more expensive. And can anybody guess what the most expensive form of paracetamol that we typically give?
Suppository.
Suppositories.
Boom.
Wait, is it actually?
Yes.
I did not expect that to be right either. I was going to say it as well. How much is it for a rectal dose?
It's £5 a dose.
Wow.
Oh,
So
wow.
is that because it's a
125
service as well?
Well, you got to think about it. You got to get a nurse to provide that medication as well.
Oh, so it's the cost. It's not just the cost of the tablet.
That's the cost of the tablet. But then,
Oh, wow.
But then you've got the additional costs of that and the cost of the embarrassment.
How big is it?
They're about the size of a normal tablet, to be honest. Okay.
So you know for
6
the
inches long.
so you know for the soluble one.
Are you suggesting could you just put that in your bum?
No, could you not just no? Let's just stop talking about bums.
Paracetamol enema.
Could you
Paracetamol.
I can't do
paracetamol?
it, sorry.
Could you not just crush up and dissolve a normal pill and
Yeah,
drink that?
this was something I was thinking.
For the ones
as well.
for people who can't swallow or chew or whatever.
Okay, so some medications you can crush, but the ones that we suggest that you don't crush, the reason we do that is because it enters your system faster than it's designed to do. I'm not going to give examples of certain medications because I don't want to give anybody ideas, but yeah, you shouldn't be crushing medications.
Can get into your system faster if you've crushed them.
Yeah.
Surface area.
So
yeah, good point actually. Yeah, surface area.
I've got a question. Speaking of good paracetamol consumption practices, how should we know when to take it? Like, how far ahead? So, because usually when people experience their pain, they take it then and then expect fairly instant pain relief.
just take it.
Just take it.
I mean, there's certain medications for headaches, for example, like sumatriptan, which is sort of like cancels out migraines. And we say as soon as you start to feel it coming on at all, just take it. So if you
Okay.
get the headache, then it won't work at all.
It's harder to get rid of than it is
Right,
to prevent.
okay.
But no, it won't get rid of it at all. You have to take it as it's evolving.
Right.
Paracetamol, if you take it after an hour or so, like you've had a headache, it's not going, then I'd probably suggest take it.
Oh, okay.
If you're somebody who has chronic headaches, first of all, make sure you see a healthcare professional. But if you get chronic headaches and you know they're going to last for hours, just take it straight away.
Cool.
Okay. But it's not just headaches where paracetamol actually is effective. It's really particularly effective in reducing postpartum pain. So after people have given birth, it's more than double as effective as a placebo. And compared to a placebo, it's 3 times less likely to require top-up medications, so there's rescue medications. But the one thing that this study did make me think is, who the fuck got through ethics giving a placebo painkiller to women who have just given birth? Like, that definitely wasn't a woman that put that study through ethics. No woman would do that to another woman. That is definitely like a fucking misogynist there, because how the hell did that get through ethics?
Was it in the 60s by any chance?
No, it was 2021.
Oh my God.
Sorry, that's really funny. Genuinely though, right?
Yeah. Look,
It's fucked up.
That's fucked.
it must be placebo with not with baseline treatment as well, right?
No. Placebo versus paracetamol. Baseline. That is your baseline.
Maybe they weren't extreme cases of postpartum pain.
You'd hope.
Yeah.
If you've got someone who's like had tearing or whatever,
Yeah.
and you're like, I'm just going to give you this paracetamol. One, I'd be like, I need something stronger than that, because if I tore my undercarriage, I'd be screaming. And 2, if you then give me a placebo, my God. Oh, also, sorry, side note here for the listeners. Up until the age of 21, I thought it was placebo because I'd never heard anyone say it. That's a fact about
Isn't
me.
your mum a nurse?
21.
Doctor.
A doctor?
Yeah. It was until university.
How have you
I then
never-
went on to do a PhD in drug discovery.
Please tell me it was me that told you it was placebo.
It was you that told me it was
Oh,
placebo.
thank God.
Because you heard me and you were like, what the fuck did you just say?
Placebo.
Placebo.
No spo.
No spo, yeah. Have a no spo effect. Yeah, so I genuinely thought it was placebo. So if anyone on this podcast has ever thought in any way that I might have a hint of intelligence behind these here eyes, you were incorrect.
I'll tell you what we should do. We should get a poll. Well, maybe not a poll, but just like a thread where people can post words that they've completely fucked up for the rest of their lives.
Butchered the pronunciation.
With words that
That
they've
entire sentence should go on there.
exactly, yeah.
Blah, 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 slurry meth.
Yeah, so we should have a thread where people can just post some of the words that they mispronounce and tell us how they mispronounce them.
I would like that.
Heterogeneous.
We did have that debate earlier on.
Yeah.
I think it's heterogeneous.
I think it's heterogeneous.
No, it sounds too much like androgynous, and I don't like the
Well,
fact that it
same
sounds so similar.
Basis. It was, okay.
I don't know. Either way, a debate for another time. We said earlier on that we were going to talk about side effects, and that will kind of be one of the things we do to bring this episode to a close. But before we do that, I want to very quickly have a little quiz for the two of you.
Ooh, I'll not read anything moving forward then. Okay, yeah.
Okay, so this quiz, we said earlier on that we don't really know how paracetamol works. So we have ideas, we have theories, but we aren't 100% sure, even now after it's been the biggest selling drug in the world for decades. So you guys have to tell me the answers to these questions about things that we don't know quite how they work. Are you ready?
I'm
Let's
ready
go.
for this.
So this is going to be a buzz-in quiz, and you only get one guess. So if you get it wrong, it goes to the other person, and they have the time that they need to put in their guess. Which animal did we not know how they reproduced until 2022?
Oh, owls.
You was quicker than that, Jesus.
Unfortunately, that's incorrect, Josh.
2022.
In 2022, so
should not
it was a
have guessed
mystery
owls.
to all science.
Fuck's sake, Don. Such a waste of a guess.
I'm going to say sharks.
Incorrect. Don, you can have a second guess.
Yes, thank you. The owls was just a joke. Sorry.
Reference episode, I think, 4, Owl or Train.
Can you repeat the question?
Which animal did we not know how they reproduced until 2022?
Some form of reptile. No, they lay eggs.
Are you both stumped?
Yeah.
Eels.
Ants. Eels?
Eels.
Eels.
So the reason...
Oh, I did know this.
Do they not lay eggs?
No, well, kind of. The reason why we were stumped was because they only have genitalia some of the time, right? And most of them, these eels in particular, were living in Europe, and the only place that their larvae, their like eggs and little baby eels, had ever been found was in the far end in the middle of the Atlantic Ocean.
Yeah.
So thousands of miles away, and people were like, how the hell have they got this far? And so eventually they found a way to geotag some eels, and they found that they swim from the Azores, so these islands in the Atlantic, on the kind of east side of the Atlantic, and they swim very slowly over the course of 18 months to this part of the Atlantic where these larvae were found, and they develop their genitalia over the course of the swim.
So they go through puberty over the
But
swim?
effectively, yes.
Or-
And they swim at over 1,400 meters deep. So they're there, just crawling at the bottom of the ocean, hiding away from the scientists, growing a dick,
Sorry, the phrase growing a dick.
And then they arrive, they spawn, and they die.
Do you know what baby eels are called?
No idea.
Elvers.
Elvis. That's quite cool.
One for the morning.
Are these? So do they go through repeated seasons of puberty, or is it just this is their
it's the
life
one time.
cycle?
Yeah.
Right.
So they come, they live in Europe, they chill out, live a good life,
Nice.
become really long sometimes, and then they swim, grow genitalia, spawn, die.
Maybe I should try
It's a
that.
bit like the salmon life cycle.
What's the salmon life cycle?
Does salmon die after every time they spawn? Do they only have one spawn?
Pretty much, yeah. Well, they go up the rivers, don't they? They exhaust their entire energy reserves to reproduce and then die.
Do they die?
Yeah.
Oh, wow. I'd just have let myself drift back downstream, to be honest.
It's a very fulfilling life.
One person said that a theory they'd heard about on Reddit prior to 2022 was that there was a single giant mother eel in the Pacific that was just basically like self-replicating loads and loads of eels.
And every time she did, there was an earthquake.
Exactly, and thousands of eels appeared.
Okay.
But yeah, so there you go. Question 1, 0 points so far. Again, buzz in when you know. Question 2, which brain chemical was thought to be key in triggering depression, but now seems not to be involved?
Dopamine.
Incorrect.
We mentioned it this fucking episode. Fuck.
If it's not dopamine, thank you, Josh.
I knew the answer before I even said
I want to
dopamine.
say oxytocin, but I think it might be serotonin.
What are you guessing?
Oxytocin.
Oh,
God, I'm going to get my second guess. I'm going to guess serotonin, Joe.
It is serotonin.
I actually knew the answer to this
Neither
as
of
well.
you get a point. But from a recent article in Nature, so one of the most well-known and well-read journals, there's basically been a review that states that it doesn't actually seem like this is a causing factor of depression anymore. The levels of serotonin does not seem to be correlated. So 0-0 after 2 questions.
Well, I got it on my second guess. And I also told Dom the answer.
How did you tell me the answer?
Because he said that we've already mentioned it in this episode, which we have.
Oh, I didn't know that. I was not paying attention then.
If it's a draw, then Josh can win for that. He gets half a point. Question 3. What physical trait affects 1/10 of the world's population, but we have no idea why this trait develops?
Left-handedness.
I was going to say Dex.
Straight out of there.
Damn it.
Do you know there's 2 reasons why it suggests that left-handed people are less common in the population, and they say it's due to less reproductive success. Would you like to know the 2 reasons that it suggests that there's less reproductive success in left-handers?
Because they're sinister?
No, that is where the word sinister comes from, but we'll break that down in the breakdown.
I don't know, Joe. I have no idea.
So one of them is because, on average, left-handed people have a smaller body.
I was not expecting that.
Genuinely, massive population study, slightly smaller body size. So on average, they're suggesting that in evolution they might have been outcompeted. And also, there's a statistically higher proportion of gay men in left-handed people than right.
What?
So they think that left-handed people basically had such a higher proportion of gay men that they were less reproductively successful, so they make up less percentage of the population.
I'm going to call bullshit on that.
The references are in the show notes. Listeners, you can
What?
decide for yourselves.
We'll research this a bit more and we'll talk about this in the breakdown.
We will indeed. 1-0 Josh so far. Number 4. What is contagious, but we don't know why?
Laughter.
No.
Sneezes.
Yawns.
Josh has got it again.
Why
Yawning.
did I say sneezes? I meant yawns.
Well, that's unfortunate, isn't it, Don?
3 reasons why people think that might be. 1 is that they think it's a special type of breathing that helps to get rid of excessive carbon dioxide.
Yeah.
2 is that supposedly it brings oxygen-rich blood to the brain by contracting the muscles of your face. Quite interesting. And the 3rd one is that it promotes social bonding. Because apparently we mimic each other a lot, and apparently this is a really great way to mimic someone. And now we've all started. Josh has started, oh God.
So you just went. I just made Joe yawn.
He
It was
actually did.
completely involuntary. He
I
had
could
no
have,
option.
if I let myself go, I could have, but I held it.
He held it.
I always got taught about the CO2, but that was back in secondary school, way back
Yeah.
in 1914.
So it's probably wrong.
Either way, Josh has run away with this, but for Don, for some
God, I'm so annoyed at myself.
for some pride. Number 5. What creature has a relationship with light that we don't
Moths.
understand? Oh, he's got it. Sorry.
Were we talking about this yesterday?
We were. I'm sorry.
Sorry, I didn't even let him go halfway through the questions.
It's
There's
alright,
a theory
it's
that
okay.
they use lights from the stars and the surface of the moon to navigate, but all of that light is coming at them from one angle. And so when the lamp comes, it's all round.
When the lamp comes.
when the lamp arrives.
Oh, sounds arguing that it's because they want the light to be behind them. That's actually... Oh, okay, so it is actually the moon. So actually, yes, you were right, 100%.
So it's basically,
Yep.
the light is coming from all angles, so they're just like, it's the moon, it's the moon, it's the moon, it's the moon, and they just keep on flying at it, thinking that they're gonna...
Damn.
This is one small step for a moth.
Flap for a moth.
This is one small flap for a moth.
One giant fly for moth kind.
So yeah,
Anyway,
there you go.
yeah, thank
so
you.
Josh, you get another point. You are racking them up now. We're catching Don, who has been streaking away in the first year of Pain in the Podcast. He had a 3-0 start.
It was fun whilst it
What's the
lasted.
current score now?
I cannot remember.
I don't know.
I will edit this in editing.
Because obviously we're filming these massively in advance. Like I keep looking at our social media and be like, "Oh, Don, how are you beating me so badly? I feel like I'm winning all these things."
I don't think you won an episode. I don't think you won a game until episode 13.
And then I've just won everything.
I don't
since.
think I've won any games.
You don't get a lot of games.
I do get some, and I lost
It's
them all
usually
quite
you
resoundingly.
you hosting the game.
No, I mean Josh you won the nuclear bananas game quite resoundingly with your consistent guesses of 27 million. Either way, a couple of things to finish off the episode. First is the side effects. So, who wants to kick us off with them?
So rather interestingly, although we give paracetamol for pain relief, it's actually been found that all-cause mortality is increased when you give paracetamol.
What is all-cause mortality, Josh?
Deaths from any kind whatsoever. So that's heart attacks, strokes, high blood pressure, GI bleeds, kidney failure, just the whole shebang.
Sorry, what's GI?
Gastrointestinal.
Okay.
Come on, Joe.
So,
G.I. Joe.
well, speaking about that, in my notes I've got the word gastrointestinal rather than GI. So actually, it turns out if you take 2 to 3 grams of paracetamol a day, so that's 4 to 6 average size tablets, you have a 3.6 times higher risk of getting bleeds in your upper gastrointestinal system, so in your stomach and the surrounding area.
It's really interesting because we typically associate NSAIDs, so things like ibuprofen, to cause GI bleeds. So if somebody came in with a GI bleed, we would stop all of their NSAIDs. We wouldn't stop the paracetamol. In
Interesting.
practice, yeah.
Oh, okay.
So again, I think it's these... There was basically an article that we were reading in preparation for this episode that argued that paracetamol would never have got licensed if it was discovered today. It would never have got through regulators, but it's just because we've used it for so long that it's able to remain.
I don't know. I mean, if they used it to test out on women who've just had babies in 2021, did you say?
But this is my point. I think they're saying because we use it, we kind of trust it, even though we wouldn't.
Ah,
it wouldn't
okay.
go through as strigorous. It wouldn't go through as strenuous review, like medical review, if it was done nowadays.
Yeah, I get that. Yeah.
But also, speaking of pregnant women, Don, I think there was something about effects in use during pregnancy.
Yes, so a study of 3,000 children in Norway found that continued use of paracetamol with the mother during pregnancy for more than 28 days was associated with higher rates of complications, particularly with motor development, communication, and overactivity.
So things like ADHD type presentation.
Kids just buzzing around because of paracetamol.
Yeah. And similarly to that, actually, a study in Denmark found that regular paracetamol usage during pregnancy was associated with a 30% increase in the amount of ADHD medication required by these kids, which I don't know why they measured ADHD medication rather than the rates of ADHD diagnosis, but they're using it sort of as a surrogate measure there.
Okay, yeah, makes sense.
So yeah, paracetamol usage during pregnancy possibly increases the risk of ADHD.
I've got an interesting risk as well, which people don't actually realise, which is taking paracetamol increases risk-taking behaviour.
Explain.
Oh, I fully see that, yeah.
So if you take paracetamol, you're more likely to take risks. So, I mean, like crossing the road a bit early when it's a bit dangerous, or gambling a bit more. There's actually a study from 2020 which shows this, which I think is quite interesting, because we dose all these patients up with paracetamol as soon as they get into hospital, and then we ask them for their consent to do high-risk procedures. So how much are we actually just like using paracetamol as?
Do you have any numbers on like how like percentage increase in risk taking?
I do indeed. Yeah, so the way the study did it was they used a computer model, which involved sort of risk-taking behaviour. We don't need to go too much into the methodology, but it was the amount of clicks or pumps of a certain stimulus, and they found that with the placebo, it was 34 pumps, and with the paracetamol, it's 39. So that's it's almost a 20% difference.
And so what you're saying is, if you're going to take 20% riskier behaviour with paracetamol, what you're saying is, if I take 5 paracetamol, or maybe 6 just to be safe, that I am 100% going to take any risk.
Maybe, who knows? We'll have to do a study on it.
Well, there you go. And I think that takes us flying towards the end of the episode. I don't know if you guys got anything else to add on the paracetamol stuff?
No, I think that's about it. So let's just sum things up. What have we learned about paracetamol? The fact that we don't actually know a lot about it.
That's one thing.
It sometimes works.
It does sometimes work. It's not recommended for chronic pain usage.
It's not in ibuprofen.
It's definitely not in ibuprofen. It costs the NHS £80 million in prescription costs every year, and every time that you get it on prescription, it's 3 to 4 times more expensive to them than it would be to buy it yourself.
Also,
Just buy it yourself.
Also, some studies are really sketchy with ethics.
Yeah.
But we already knew that before.
We most certainly did. So basically, when your doctor, like Josh says, tries to give you paracetamol, think about maybe whether it's the right choice for you. Make sure you're making an informed decision.
Make that decision before you take the paracetamol, because we know you're going to take more risks.
Exactly. And then you might take more paracetamol because you feel more risky. It's
Oh,
a
no!
self-fulfilling prophecy. But either way, with that, we will head over to our book review. And this week, This Is Going to Hurt by Adam Kay.
Ooh, I'm literally reading this book right now.
And what are you thinking so far?
I'm loving it. I adore it. Yeah, as a doctor, it resonates with me. And do you know what? I think it's actually really good for non-medical folk as well. There's little bits at the bottom which he gives little insights, which are quite funny, but like explaining terminology, giving sort of more background on things. I love it. It's very medically accurate to the experience of a doctor in the NHS.
And that's exactly what it is. It is a diary of someone who was a junior doctor in the NHS. And I have to be honest, this is my favourite book of all time. I think it is a perfect 50-50 mix between absolutely heart-rending stories of his challenging experiences during...
Please, no spoilers. I am only a third of the way through.
No,
so
that's
far.
fine.
Yeah.
But 50-50 mix between his heart-rending experiences as a junior doctor and also absolutely hysterically funny things that people did or that he came in to see him with.
Ooh, can I read an excerpt?
Absolutely. I don't know if we're going to get sued for this, but...
Okay, so here's an excerpt from page 37 of It's Going to Hurt. Wednesday, 16th November 2005. I glanced at the notes before reviewing an elderly gynae patient on the ward round. Good news. Physio finally been to see her. Bad news. The entry reads, patient too drowsy to assess. I pop in. The patient is dead.
Oh my god.
Just thought that would be quite funny for Joe, because, you know, he's a physio.
Well, yeah, thank you for this.
It's okay.
And I suppose on that note, join us for our episode of The Breakdown on Patreon next week. Thank you very much for listening. And until next time.
Don't trust your physios.
Sayonara.
Goodbye. Take care.
Kanye.